Hello, I am making this video to document my cancer journey as well as possibly help anyone else going through something similar. My name is Jenny. I am 33 years old. I have a 5-year-old and a 1-year-old, and I have cancer. I was diagnosed with cancer on March 19th, 2021. I have stage 3 adenocarcinoma, stage 3A, and it's non-small cell, which is non-smoking lung cancer. It is the next day, and I realized I forgot to say that we were surprised by this diagnosis because I'm a pretty healthy person. I'm 33 years old. I don't smoke. I've never smoked. I don't drink alcohol. I haven't had alcohol since before I was pregnant with this cutie here. I'm vegan, so I eat a plant-based diet. I use natural cleaning products. I try to use natural products that go on my skin because I know my skin's going to absorb it all. So we were quite surprised that living a pretty healthy lifestyle, I was still able to get cancer. But I guess that's not how cancer works. One of the oncologists that I saw said that if you have lungs, you can get lung cancer. So there it is. Hi, Alice. Little backstory, I have had rib pain since right after my daughter was born. The rib pain I've heard could be related or could not, but I've had rib pain since a little after my daughter was born, so about 1.5 years ago it started, a little over, and I wanted to go to the doctors for it in March of 2020, but the COVID lockdown happened, so I decided to wait till COVID was over, and COVID didn't end, so I went in August of 2020, and I went in for rib pain. I told the doctor that it had started in my lower back ribs, and then eventually the pain after months started going to the side of my ribs, and I was having a lot of spasms, and then eventually I started getting sharp pains in my chest right here, in my ribs, and that I was now having shortness of breath. I could no longer sneeze like I used to. My body had to adjust it. I couldn't yawn like I used to. I told him all those symptoms, and he said that I probably injured myself from lifting my babies or my kids, and to stop lifting and to continue stretching and doing yoga as I do. And I requested blood work. I thought maybe the shortness of breath was due to low iron, but my blood work was perfect. The doctor actually thanked me for being so healthy, and I asked for an x-ray to see if there was a fracture or a broken rib, and there was nothing. And then I asked for an ultrasound of the spleen to see if there was anything, because it's down where some of the rib pain was, and that all was fine. I wish I would have known to ask for a chest scan at the time, because I'm sure it would have been there, but I didn't know, and I'm surprised that my doctor didn't suggest checking my lungs if I was having shortness of breath. But over time the pain got worse. Even though I wasn't lifting my kids, I would do it a little bit but barely. And so in January of 2021 I decided to do as much yoga and stretching as I possibly could. I thought, okay, this is my final, this is the only other thing I can do to fix it, because I've been resting it. I don't know what to do. So I did yoga 5 to 6 days a week with stretching all of January, and it flared up my ribs so much. I was having so many spasms, and it was awfully painful, but it was okay. I was able to do it. And then as soon as February of 2021 hit, I tried to do my regular yoga routine. I do the same one every time, and I couldn't get through. I could only do about a quarter of the routine before I was huffing and puffing, and I had to sit down, and that was a few days in a row where I couldn't do it, and I knew something was wrong. I didn't know what. but if I couldn't even do a simple yoga routine, it wasn't right. And then one day at the beginning of February, I was walking my kids to the park, and I had to stop like 3 times, and we live right by the park, to catch my breath. And by the time we got there, I was like leaning on their little wagon, like so out of breath. Like they're saying, "Mommy, play." I couldn't play. My son wanted me to chase him. I couldn't chase him. It just broke my heart. And so I knew I needed to go back to the doctors. So I tried to book with my regular doctor. He was booked for months. And I went to urgent care, as my sister told me to do. She's a nurse, and she and my husband coached me on being an advocate for myself, because I tend to be too nice and just go with the flow, do whatever is said. But this had been going on so long that I needed to stand up for myself. And so when I went to urgent care, the first thing I did was explain the situation, and I said that I would like an MRI of my chest, and I didn't know what kind of scan I needed. I just knew an MRI was a scan. But I said I wanted someone to look inside my chest and see what's wrong, because I've had this pain for too long. And the PA that was helping me said, "No, we won't do that. I can do blood work, see how, if you're having a pulmonary embolism, or I can check your heart." And I said, "No, that's not what I want. I would like someone to scan my chest." And I started crying, and she was very uncomfortable, and I like begged and pleaded. I said, "I've been in this pain for over a year. Please, can someone scan my chest and look at my chest and see what's wrong?" And she said she would do the blood work, and if the blood work showed anything alarming, then she would do a chest scan. And so then I had to be more pushy and say, "No, please, even if my blood work is perfect, will you please still do my chest scan?" And she agreed to. And a couple of people that were helping me thought it was weird. Like, "Oh, why are you getting a chest scan? Your blood work is perfect." And I was just like, because I don't know. And so I had to wait at the hospital for the results. I was there for probably 6 hours. The blood work was good. My heart was good. They tested my heart. And then at the very end, the PA called me into her office and said, "We found something on your left lung." And she kept calling it something, and there's opaqueness around it. Yeah, I don't know what it is. I'm gonna send you to a pulmonologist. I'll refer you to a pulmonologist, and they'll tell you what to do next. They'll send you for testing. And I said, "What kind of testing? Do you mean for cancer?" And she said yes. And my heart sank, and I knew in that moment that there was a very good chance that I had cancer. And the pulmonologist called me a couple days later and sounded very alarmed. She said that it was very odd, and I asked her, "Do you think it could be cancer?" And she said, "Yes, I definitely think it could be cancer." So when she said that, my husband and I kind of accepted it as cancer. Even though we didn't have an answer, we grieved that night like it was cancer, the next night like it was cancer. We had our lowest days. We broke down. And then I had a biopsy on March 17th of 2021, and a lung biopsy, and I will do a video about that for anyone who's interested in how that works. And on March 19th is when I got the call that it was in fact cancer. They called in the afternoon, my pulmonologist did, and said it was cancer, that I'll be getting calls next week for more tests. They need to see if it's spread to my brain, because I have a history of aura migraines. They need to see if it's spread anywhere else in my body. And they kind of just left us with nothing, like no information to look up, like you can check out this website to learn about cancer treatments or the process, nothing, just you have cancer. So I was diagnosed with my cancer on Friday, and then by Sunday night I reached a state of panic, and I was in a state of panic for probably 12 hours after that. That Sunday night I think I had about 4 panic attacks. I couldn't sleep. I called my sister asking her what to do, and the strongest medication I had in my house was Kids Benadryl, so I took Kids Benadryl and it didn't really do much. But the next day I was rocking and shaking uncontrollably. I was in a state of panic. I couldn't function, I couldn't do anything. Luckily my husband was home on spring break and my sister was on spring break from work. So my sister came right over. She started calling a psychiatrist, a therapist. They got me anxiety medication to get me out of this state of panic, and they got me a therapy appointment, which was so amazingly helpful. So if you're having anxiety from your diagnosis, I highly recommend calling a psychiatrist and a therapist, because they will definitely help you. They helped me that day, and that day I was able to go pick up medication to help me get out of this panic attack that was just ongoing. And then I had a PET scan, and the PET scan showed that I for sure had the mass in my lung was cancerous. It was like the most lit up from the scan. And then in the center of my chest I have lymph nodes that flared up. None of the lymph nodes flared up as much as the tumor, but they flared up in the middle, and then I think one down in my armpit, and then I think one in my lung, like a long weird one in my lung. And so tomorrow I'm actually going for an EBUS to get a biopsy done on the center lymph nodes. And they said if it's non-cancerous, if it's inflammation, then that means it's not cancer, and there's a chance that my other lymph nodes could not be cancer. They said that if it is cancer, then they'll just go ahead and proceed forward with chemo and radiation as the first step of my plan. But if it were inflammation, then they would open me up and check all the other lymph nodes right while I'm open. If none of them are cancer, then they would cut off part of my lung right then. If even one of them was cancerous, then they would just close me up and start chemo and radiation. It's already been a month since I was diagnosed, and I have yet to start treatment, but I think that's because of all the tests and waiting for results. I had to do genomic testing, and that took like 2 weeks. And yeah, we don't know if the rib pain is related to the lung cancer, but I think the front rib pain is. And I can no longer yawn. Sneezing hurts, hiccups hurt. I don't know if all of that's related to lung cancer or my other rib pain, I don't know. But well, that is it. Thanks for watching. I hope this was helpful. I will be making more videos on this journey. Bye.